Hello, I'm Dr. Julie Codiff. This is Chapter 7 from Martini Human Anatomy, the skeletal system, specifically the appendicular division. So we're going to look at the pelvic and pectoral girdles here, so your upper and lower extremities. So we looked at the axial already, or this kind of centerpiece here of our bodies, and now we're going to look at the appendicular. And you can see it's in this kind of peachy color here, or this kind of bone color. Okay, so we're going to look at pelvic girdle, pectoral girdle, upper limb, pelvic girdle, and the lower limbs. And this is a really good slide to kind of stop, pause, and look at these bones. The numbers here are how many bones there are. So there's two clavicles or collarbones. This is your area right here, okay, right here. And you can see it from the back a little bit here as well. So two collarbones or clavicles, two scapula or shoulder blades, okay, two humerus or upper arm bone, two radius, which is part of the lower or forearm bone, two ulna, one on both sides. So these are not two ulnas here. There's one radius and one ulna, and one radius and one ulna on your forearm here. Carpal bones, there's going to be 8 on each side, bilateral and symmetrical. 5 metacarpals on your right, 5 metacarpals on your left, and 14 phalanges on your right and 14 on your left for a total of 28. That's how you read these bones here. And then the hip bone here is kind of a generic term. You'll see it called a couple of different things. It is a combination of 3 bones, ilium, ischium, and pubic bone, and we'll look at that in a moment. The femur, or this upper leg bone, the longest bone of the body. Okay, so the longest bone of the body. And we have a patella, which is a kneecap. Tibia is on top, okay, right here. Fibula is off to the side and smaller. Lateral, L for L here. Fibula, a fib is a lie, so that's the L. And lateral, okay, fibulateral. Tarsal bones are just like your carpal bones up here. So your carpal bones are your wrist bones. Tarsal bones are the foot bones that are analogous to those carpals. Metatarsals, we had metacarpals up here. Metatarsals are between your tarsal and your toes, or your phalanges. So fingers and toes are both called phalanges. So we're going to look here at the clavicle and the scapula of the pectoral girdle here. And so what you want to see here is the clavicle is this collarbone area right here. And so this is the collarbone or the clavicle, and this is a front-facing view. So the face would be up here, and this is the breastbone. Okay, and so we would see ribs here as well. Okay, so behind the rib cage, behind your lungs, okay, and then out on the other side of the rib cage is this view here. So we would be looking through the person. Okay, so the manubrium is just the top of the sternum. So we have the sternal body, and then down here would be the xiphoid process, not pictured. And so that's where we are in space here. And so we're looking at the shoulder blade from this kind of internal view, this inside view. And this right here, subscapular, so below the scapula, subscapular fossa. Fossa is this kind of indentation in the bone here. And remember our medials and lateral? Okay, so the midline of the body is going to be over here, right, at the sternum. And so this is going to be the medial border of the sternum. This is going to be the lateral border of the sternum. Sometimes you will see this called axillary border because the axilla is over here, or the armpit, okay? You might see this sometimes called not only medial border, but spinal or sternal, depending on what you're reading, okay? So it's more towards the midline of the body. So up here, let me move some stuff. We're going to see the superior angle, okay, of the scapula, and down here we see the inferior angle of the scapula. So we have directions: medial, lateral, superior, and inferior of our shoulder blade or our scapula. Now this little bony process here is the coracoid process. Okay, coracoid process, not coronoid that we saw with the TMJ area, but the coracoid process, and there are going to be muscle attachments here. Okay, so namely pec minor, bicep, and coracobrachialis. But right now we just need to know this little bone protrusion here or process called the coracoid process. Okay. And then coming around from the backside here that we'll see in a moment, we see this acromion process. Okay, so AC joint is this right here. The acromion at the clavicle. So the C is for the clavicle and the AC joint, okay? Not the coracoid. Okay, so this is a nice one to work on here. So we can see the sternal end being the medial end, the acromial end being the lateral end. So this is lateral, this is medial, because this is midline towards the body. And so we see a lateral end, oh, and a medial end or sternal end here. We see a conoid, right? So very similar sounding names, tubercle, right? Conoid, tubercle, just this little bump here, okay? This little bump right there near the acromial end. And then we see the costal tuberosity, and costal, if you remember, means rib. Okay, so you'll see this little area here where the rib is going to articulate with. Okay. So we'll look at these terms here again in picture form. So what we want to look at here is this gets a little bit more complex in a couple different views. So what we saw before was this view here. Okay, so we saw that view right there with our medial and lateral border, our subscapular fossa here, the inferior angle, the superior angle. We're adding in that superior border here. We see the coracoid process and kind of a different plane here than what we saw before. And then the acromion coming off of, see back here, this is the back side of the scapula here. So what you see is medial border here because the face would be here, okay? Now this would be the back of the head here for this one, okay? So we see a medial border here and a medial border here. It's just flipped. That's all that's telling us. We see the lateral border here, the lateral border here. So your arm would be here, the back of your head would be here. Okay, so here is that acromion process. So it's really just this extension from the spine of the scapula, and you can feel the spine of the scapula on most people. Okay, so we see the spine of the scapula, and then this end here kind of wrapping around towards the front called the acromion process. And then you see just this little part here called the neck. You can see the coracoid process a little bit from the back view here, okay? But that's this right here. And then when we learn our muscles, we're going to see the muscles that attach in here. Okay, so we're going to see supraspinatus and infraspinatus muscles attaching at the supraspinous fossa, supraspinatus muscle, infraspinous fossa. Okay, would be then the infraspinatus muscle. Okay, so these are going to be significant for what muscles are attaching into these areas. Fossa is just that indentation, remember, in that bone. We saw it earlier with that subscapular fossa. And then this is a side view or a lateral view. And we could see this glenoid cavity pretty well here now. So this is where the humerus, right, or your upper arm bone, is going to articulate with the shoulder blade. Okay. And you could see the supraglenoid tubercle a little bit better here, which is just going to be this little kind of bump at the superior glenoid cavity. Okay, so just above that area there. And we could see it here as well. So the glenoid cavity and fossa right here, our humerus is going to articulate into that, or our upper arm bone. Okay. So here it is for you again. And you can work on this. So you could pause this screen and quiz yourself, right? And use those words down here to fill this in right here. It might look like this on an exam if you get this exam question drawn into your quiz. Okay, so you'll have to identify these letters and be able to know what bony landmarks these are. Okay. All right, so humerus, ulna, radius, carpal bones, metacarpal bones, and phalanges. These are just fingers. Fingers and toes. Okay. These are your wrist. Oops, there you go. Upper arm bone, lower arm bone, or forearm bones. Carpal bones are your wrist. Metacarpals are in between your fingers and your wrist. And here we go. So we saw the scapula and all its bony landmarks. Our humerus, we saw the glenoid cavity or fossa is where that humerus articulates with the scapula. We see humerus, we see radius, we see ulna, right? We see the carpal bones, we see metacarpal bones. So this is before your fingers. So if you are looking at your hand, your fingers are free here, right? But these are really not. And so we have the bend of the wrist, and then we've got this making up the palm of the hand, okay? Posterior or anterior, however you want to look at that. So we want to kind of look at all of these components here, okay? And this is a nice view of that. So we see the arm bones here is what you want to look at, and that head of the humerus was articulating with that glenoid cavity or glenoid fossa. And then we see these different components. So here's the head of the humerus. And then here, there's a couple of different neck areas. Let me get a different color for you. So we have an anatomical neck and a surgical neck there. Okay, so kind of important if this is your specialty, if you're going to be working in ortho, these are distinctions you'll want to know. Otherwise, just kind of know there's a rhyme and reason to all these different things. So things we want to remember, greater tubercles. So the tubercles are just these bumps, okay? These bumps here. And these bumps are for muscle attachments. And when we look at the different muscle attachments, specifically rotator cuff, this will start to make a little bit more sense. But right now we're just learning these little bony landmark names. We have a greater tubercle and a lesser tubercle. A greater tubercle and a lesser tubercle. And then what you'll see here is this intertubercular sulcus. It's just in between the tubercles. That's it. That's all it means. Intertubercular, in between these tubercles, right? Is just this little groove or sulcus. Right? And this is going to be the bicipital tendon in here. Right? But we don't need to know that yet. But that's all that's telling us. These bony landmarks are for different structures, so we know where we are in the body. Okay? Deltoid tuberosity, I'm gonna bet that you would bet that the deltoid attaches there, and you're right, right? And then we see the shaft of the humerus here. Okay. And then at the lower or more distal end here, we can see the areas that it's going to attach to the radius and the ulna. And they all have these different little names here. So we could see the radial fossa over here. And then we could see the lateral epicondyle epi above or upon, remember? And then the capitulum, you can see at the bottom there, trochlea as the condyle. And then you can see the medial epicondyle. So if we have a lateral, we're going to have a medial. You see the little coronoid fossa, again, that little indentation in that bone. And then capitulum and trochlea here, medial epicondyle here. So we're just looking at these bones in detail here. Another nice viewpoint for you here to work on. Now, when you go into Canvas, you should see a couple of bone handouts. And when you look into your lab manual, you'll see some there as well. Okay, so use both those resources to help you study for this. And you can start labeling the bones if that's a preferred study technique for you. Good. So we're going to look here at the ulna and the radius. So radius is going to be lateral to the ulna. The head of the radius pivots on the capitulum of the humerus. So if you stick your thumb up, like you're doing a thumbs up, and then twist your arm back and forth into pronation and supination, okay, the radius is going to be radiating around on that ulna. And here are those terms. So you could see it's the lower two arm bones here, really analogous to the two lower leg bones, the tibia and the fibula. Okay, but as we evolved, these kind of evolved with us, right? And so the olecranon, that is the bony process of your elbow. And so if you were to elbow something, okay, that little bony process there, powerful thing, right, is the olecranon process. Okay, so the olecranon process of the ulna. Okay, and then so we see ulna right there, and then we see radius. Okay, radius. And then we see proximal radial-ulnar joint. That's just the radius in the ulna joint. Proximal just means it's closer to here than here. This would be distal. Okay, so this is proximal. Oops, right there. And then you see the head of the radius, the neck of the radius, and we see these interosseous membrane or this connective tissue between these two bones. Okay, nice strong connective tissue. Linking the bones there, stabilizing the two bones. So there's going to be muscle in here as well, all along these bones. Okay, superimposed on that at a different time. And then as we look down here, we're going to see these different things like the ulnar notch or the radius. Okay, so the ulnar notch of the radius. So that means it's on the radius bone, but it's a little notch for the ulna bone. That's all it's saying. And then we see the styloid process. And so it's just this little pointy area here. So think your styloid for your iPad. Okay, it's like a pointy pen, right? So same thing here, the styloid process. Okay, and then of what bone? The ulna here. Okay. Articular cartilage, just where something is connecting in with something. Okay, where a bone is meeting a bone or joint area here usually. And then we see this being the distal end. This would then be the proximal end. Great. You can see it from this viewpoint here as well. So as we look, you could see the C shape here. Okay, this is a C shape of the olecranon. And then all those same structures. So go ahead and pause here and look through that as well and kind of quiz yourself and see which bone is which and which bony process is what. Here's that nice C shape of the olecranon that we're talking about there. And that's called the trochlear notch, the coronoid process, the radial notch area here, and the ulnar tuberosity. And these are all just bony landmarks. And they're either going to articulate with another bone or be an attachment site for a muscle. Pectoral girdle and upper limb. So we're looking at our carpal bones now. So there's going to be 8 bones of the wrist, and they consist of 2 rows, proximal row and distal row. Distal is going to be towards our fingers a little bit more, and the proximal is going to be closer in towards the midline, of course. So we're going to look at these names here. So scaphoid, lunate, triquetrum, and pisiform, and then trapezium near the thumb, trapezoid, capitate, and hamate. I know it's a mouthful, but there's another sheet here on your Canvas page that you can practice drawing these out a couple of different times as well. Okay, so here's the radius, here's the ulna, okay, and then these bones right here. So scaphoid, lunate, triquetrum, pisiform. Trapezium near the thumb. Trapezoid, capitate, hamate. And you can look up mnemonics that would serve you best for how to remember these. Everybody's going to have a different mnemonic for that. Okay, so scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. So take a little time, write those out over and over and over again until they become words that are familiar. Okay, and then the way I liked to write them out was how many were there? There were 8, 2 rows of 4. Now, when you see this, it doesn't look like that, but this is a much easier way to try and remember it. Okay, and so we start off on the radial side here: scaphoid, lunate, triquetrum, pisiform, trapezium near the thumb, trapezoid, capitate, hamate. So I would just write that out over and over and over again that way. And so again, I just write out a big old 1, 2, 3, 4, 5, 6, 7, 8. And I just go scaphoid, lunate, triquetrum, pisiform, trapezium near the thumb, trapezoid, capitate, hamate. Over and over and over again, okay, until you can't get it wrong, right? In order to be good at something, we do something until we get it right. In order to be great at something, we do it until we can't get it wrong. All right, so our metacarpals and our phalanges. There's going to be 5 metacarpals, numbered 1 through 5. Metacarpal associated with the pollex is number 1. What does that mean? That is your thumb. I almost wrote big thumb. That is your thumb. Okay, that's your thumb. Okay, hallux is going to be your big toe. We'll get to that in a minute, but pollex is your thumb. And then we have phalanges. We have 14 phalanges on each hand. I'll show you the issue here. So the thumb only has 2 phalanges. Everybody else has a proximal, middle, and distal 3. And the thumb only has 2. So if you look at your thumb, you can bend your thumb, you see 2 parts to it. If you look at your fingers and bend your fingers, there's 3. Okay? And so we're looking right here. Metacarpals 1, 2, 3, 4, 5. And now we're looking right here to the phalanges, okay? The thumb has these 2, let me get something that shows up better. 1, 2 spots, okay? And then the fingers, pointer finger has 3, middle finger has 3, ring finger has 3, and pinky finger has 3. Okay, let's do that again. Thumb has 2, a proximal and a distal phalanx. That's the singular for phalange. Okay, and then pointer 1, 2, 3, middle 1, 2, 3, ring 1, 2, 3, and pinky proximal phalanx, middle phalanx, distal phalanx. And then the metacarpals would be, this is the one for the thumb. 1, 2, 3, 4, 5. This is going to be like the palm of the hand and the back of the palm of the hand. Okay, and then these are carpal bones, scaphoid, lunate, and so on. That's your wrist. Okay. So this is a nice one to look at and study from. And then I have this here for you on Canvas. You can also just pause this and start to write on these and see how you do. Okay, so I'll erase that for you so you can pause that. Go ahead and pause and then press play when you're ready, and I'll meet you on the other slide. Right, pelvic girdle consists of 2 hip bones, sometimes called coxal bones. Each coxal bone is made of the ilium, ischium, and pubis. And we're going to see the acetabulum here. I'll show you what that is in a minute. And then the lower limb is the femur, the patella, which is the kneecap, and then the tibia and fibula, which are the lower leg bones, tarsals, which are kind of like your carpals, but in your feet, and then metatarsals, just like metacarpals, and then phalanges. Again, that word is also used for fingers. It's also used for toes. And you can see it here. So the pelvic girdle, or the hip bone, made up of those 3 bones, ilium, ischium, and pubic bone. Here's the femur, right? And then this is a ball and socket joint here. Just like we had the head of the humerus and the glenoid fossa or glenoid cavity, right? We're going to have the head of the femur and then the acetabulum. Okay, so this word right here, okay, is this part in here on the hip where the femur head is going to articulate or connect with. The patella is the kneecap, tibia, top, fibula, L, right? Lateral. Okay, so to remember this, right? So we call it tib fib all the time. Tib fib, right? And tibia, fibula. Okay, there's an L here. And how to remember that, right? So a fib is a lie. That's another word for a lie, right? So that's how I always remember that's the one with the L. Okay, a fib is a lie. So it's fibula. And then I remember that L because that's the lateral aspect of the lower leg. And then in a little bit, we're going to see something called the lateral malleolus. We're going to see a medial and a lateral malleolus. The lateral malleolus is made up of the fibula. L for fibula and L for lateral malleolus. The medial malleolus is going to be made of the tibia. Right? So a couple of different ways to remember that. Then we see our tarsal bones, which again are going to be kind of like the carpal bones in the wrist. Right? They're going to be bigger though. And remember, everything is about stability versus mobility. Upper extremity is going to be more mobile, lower extremity more stable. Okay. And then metatarsals, just like we had metacarpals, and then phalanges, okay, are toes, just like phalanges are our fingers. All right, we're going to look at the pelvic girdle of the hip bone here and these anterior structures. And so what we're looking at here is from the front. Okay, so remove all of the structures except for the bone, and we're looking at the front of the person. Okay, and so yes, this is the vertebra or the sacrum back here, and L5 back here. These are the backbones, but we're looking at it from a frontal or anterior view, or A to P view is what it would be called technically. Anterior to posterior view is the way we're looking in. Okay, and so first thing you might notice is this pubic symphysis or this cartilaginous tissue in between the two pubic bones. And so we could see the pubic bones here. Okay, pubis or pubic bone is just fine as well. And then that's the pubic symphysis in the middle there. And that's going to keep these from breaking, right? So it's going to have a little bit of shock absorption of different pressure, but it's namely going to, in the female, it's going to allow for movement, separation, so the mom can give birth. Okay. All right. And it's made basically of similar material of the intervertebral disc. Okay, so intervertebral disc in between the vertebra. So we've got the pubic bone here, and then we're going to look and see the ischium here. Okay, so the ischium is, if you've ever been to a yoga class and they talk about your sit bones or your sits bones, for the bone that you are sitting on, the little bony protrusion there, that's the ischium. Okay, so that's our ischium. And then the ilium is this big aspect up here. Okay, so the big aspect up here. And when we look at the acetabulum here in a different viewpoint, in this little ball and socket part of the joint here, we're going to see all three of these bones representing a part of the acetabulum. We'll see pubic bone, ischium, and ilium all represented in that socket part of the ball and socket joint there. So if this is the sacrum, okay, and this is the ilium, this is the sacroiliac joint right here. This line right here. Okay, so I am a chiropractor. I adjust this joint all day, every day at work. Okay, that SI joint is exactly where we start. A lot of us start working right there. And we balance the foundation of the body by balancing that because this can start to tilt a little bit. Okay, so things can tilt based off of muscular imbalances, normally from a fight or flight response where we go into this kind of tilt of the body. Think about the fight posture where one leg is forward, one is back. But we'll talk about that later with the nervous system when we talk about fight or flight postures and what it does to our body. But this is the normal structure here, normal alignment. So you could see this line right here, that's the SIJ, sacroiliac joint, right there. Right. What else do we see over here? We see some bony landmarks over here. We're just going to look at these as muscle attachments, basically. Okay. And then for Raymond, you know this word right here means a hole. Okay, so this is this giant hole right here. Okay, this giant hole right there. Okay. All right. Good. Now we're going to look at the posterior structures here and we see them right now. So this is the sacrum again, right here. And then at the very bottom here is the 3 to 5 fused bones of the coccyx. Okay. And we see the 5 fused bones of the sacrum, and they're fully fused at about age 25, maybe 20, 21, 22, 23, 24, 25, anywhere around there. And then we see the ilium. Okay, so you see the iliac crest, okay? And we see this bone here all as the ilium. Right? And then we see that ischium and the ischial tuberosity. Tuberosities, again, are just little bumps off the bone. You're going to see muscle attachment here, especially the hamstrings. Okay. See the little spine here is just a little pokey spot on the ischium. And then you could see the coccyx here again, 3 to 5 fused bones down here. And we just see these names for some bony landmarks where we're going to see either nervous system structures or muscle attachments or ligament attachments on these different bony landmarks. Foramina, it's just a hole again. Okay, so foramen or foramina, you'll see them interchanged a lot depending on what resource you're looking at. So foramina usually denotes a smaller hole, but sometimes it can be really large, right? So this one's rather large here. Okay, so what else do we see? We see the posterior inferior iliac spine, and we see the posterior superior iliac spine. These are just bony landmarks. This right here, very common to be able to feel. Okay, a little bump off of the back of your spine. Okay, kind of at the top of your glutes a little bit there. Okay, the glute comes all the way up, but you'll feel it kind of right here. So that's what we're going to see here is we're going to see these initials, and they'll be confusing at first, but you'll get it. Posterior superior iliac spine, the PSIS. Okay, very common bony landmark to when examining a patient. Okay. This right here, not as common as a landmark when we are examining a patient. Posterior inferior iliac spine. Okay. And same thing on this side here. With that, we have an anterior, okay, superior iliac spine, ASIS. Another very common bony landmark. These are your little hip points here. So if you feel the front of your hip and you feel these little bony landmark hip points, as they're sometimes referred to, that's the anterior superior iliac spine, or the ASIS. And then in the back, we see the PSIS. Okay. You can see the entrance to the sacral canal. You're going to see, well, the spinal cord itself ends at about L1, L2, then we call it the cauda equina. Okay. And so, which means horsetail, kind of like a ponytail. And so we're going to see that come out of these holes here. Okay. It's not really going to look like that. Again, why I'm a science major and not an art major. Okay. Greater sciatic notch. Okay, so we're going to see the sciatic nerve here. Great. All right, so structure is easily seen on a lateral view or from the side. So here is going to be that acetabulum that I was talking about, this acetabulum here, okay? This space here, kind of like the glenoid cavity or fossa of the humerus and the shoulder blade. Okay, so this would be the ilium, ischium, and pelvic bone here, making up the acetabulum, but the shoulder blade is going to give you the glenoid cavity. Okay, so two ball and socket joints that we look at. So if you look at the color coding here, the pink is pubis, ischium is this kind of tan color, and then this purpley color up here is the ilium, and you can see how all three colors are represented in here in that acetabulum. Okay, so we're looking right here, here, here. Okay, cool. So here's the iliac crest, that top. Okay, and then you can see this anterior gluteal line, so you're going to see glute fibers attaching here. Okay, anterior superior iliac spine, we could see a viewpoint of it right here. Okay, so it's just that front hip point right there. Okay. And then the AIIS, not as much of a bony landmark for most of us. Okay, so ASIS, a little bit easier to find. And then same thing with these notches, these different surfaces, the fossa. All of these, again, you want to think of this as bony landmarks or articulation points with other structures. And that's why they label them this way. So depending on what specialty you're into, you may or may not need to memorize a lot of this. So again, we see sciatic nerve, okay, so sciatic notch, ischial spine, lesser sciatic notch, and we'll look at how big that nerve is when we get into the nervous system. But basically, it's going to be the thickness of your thumb, okay, so it's going to be that big, usually, okay, so the thickness, diameter of your thumb. Right, medial structures here. So we see this lateral view, so the femur would be here. Okay, so the femur is right there. And now we're looking at this medial structure. So what's here? This is where the sacrum is in the middle. Okay, so this medial view is going to be this view here, but of this bone. Okay, so we're looking at this view this way of this bone. Okay, cool. So that's what we're seeing on this. Okay, so it would actually be the other bone. So we see iliac crest again, anterior. So this is the front side here. Okay, so anterior ASIS, okay, AIIS. And then we see all sorts of, so these different grooves, obturator groove. We're seeing the rami, we're seeing pectineal line, tubercles. Again, all of these are just bony landmarks for muscle attachment or where nerves are, and just different ways to communicate where an injury might be. Okay, good. All right, so a greater and a lesser pelvis. So greater pelvis spans the distance from left iliac crest to the right iliac crest. Lesser pelvis is the area inferior to the iliopectineal line. We see a pelvic inlet and a pelvic outlet. So the pelvic inlet is the superior space between the pelvic brim of each coxal bone. Pelvic outlet is the inferior space between the ischial spine of each coxal bone. So what does that mean? So here's our sacrum, okay, coccyx right there, ilium, okay, ASIS right here, and then we see this is then a superior and also A to P view. So the internal organs were in here first, okay? So we see the pelvic brim is this, okay? And then we see this greater pelvis, this line to this line here, greater pelvis, okay? And then we see the pelvic inlet and the pelvic outlet. So pelvic inlet is here to here. Pelvic outlet is here to here. Okay, so just these different measurements. So when we look at these measurements are going to be different based on male and female structures. Okay, so larger in females for that pelvic outlet. Why? Obviously, right? The female is going to be built to be able to give birth. So this pelvic outlet needs to be bigger to facilitate this. Okay, so larger in females than in males. A sacrum curve, less curvature in females than in males. Pelvic inlet, wider in females than in males. Pubic angle greater than 100 degrees in females, less than 90 degrees in males. Okay, so again, to facilitate giving birth. Okay. And then the male structures are going to be a little bit more stable. Okay, so trading off stability for mobility. Okay, the ability to give birth versus a little bit stronger, more stable, less likely to break, and be able to carry more weight. Okay, a little bit stronger structure. Okay. So you could see where this kind of wider area would be a little bit more vulnerable, right? And then this narrower area less vulnerable. Okay? And why? Right? Again, to be able to give birth. So you can kind of look at the difference here between these pictures and look at the inlet, the outlet, and the curvatures and the angle. Okay. So you'll see this on forensics, or if you watch any of those forensic shows and they're identifying bones, right? They're going to look at this pelvis, and that's going to give huge clues, right, into whether the bones belong to a female or a male. Lower limb, femur. So we're going to look at these structures here. Okay, so again, you'll see in your lab manual and in Canvas various bone handouts for you to label these because they become words once we start to write them out a little bit better. And so we see head of the femur, we see the neck, we see the greater trochanter, and we see the lesser trochanter. Greater trochanter is going to be on your outer hip area or the lateral aspect. Lesser trochanter is going to be towards the groin. Okay. And then this is the shaft of the femur. And then we see the patellar surface for the patella, which is your kneecap. We see the lateral epicondyle, medial epicondyle, and then the condyles. Epi means above and upon, right? So here's the epicondyle and here's the condyle. So this is the part that's on the condyle or above the condyle. Okay, so now we see the head of the femur here. We see the neck here. We see the lesser trochanter. So this is the medial aspect of the body. This is the lateral aspect of the body, greater trochanter, gluteal tuberosity. And yep, you guessed it, glutes are going to attach here. Linea aspera, supracondylar ridge, medial supracondylar ridge. Again, just areas for muscle attachment. Popliteal surface, adductor tubercle. We're going to have our adductors attach here. Okay, so all these different little bony landmarks here. So kind of practice writing these out and drawing them out. Patella is the kneecap. So this is the largest sesamoid bone, the only real sesamoid bone of the body. If you want to get philosophical, you might be able to think of some others, but sesamoids are located in a tendon. Okay, so you will see other sesamoid bones in the body and the foot and maybe in the hand. Okay, but we're usually not born with them. Okay, and so this patella is blueprint for all of us, but the other sesamoid bones are not necessarily blueprint for all of us. Okay, so it protects the knee joint. It's going to give more pull, something for muscles to attach to and things to embed on. Okay, and we're going to see these different aspects of the kneecap. Okay, so we're looking at the posterior view here. Medial facet for medial condyle of the femur, lateral facet, articular surface of the patella, and we see this anterior surface of the right patella. We see the base of the patella up here, and we see the apex of the patella down here. Where did we see that before? The sacrum had the base on top and the apex on the bottom. Okay. So base here, apex here. Right? And then you're going to see the attachment for the area of the quads and the attachment area for the patellar ligament. Okay, so base and apex. Tibia. Okay, we're going to see tibia and fibula. Okay, so tibia is medial to the fibula. Fibula is lateral to the tibia. Okay, so tibia is going to give you the medial malleolus. Fibula, okay, is going to give you the lateral malleolus. And here we go. Top, bottom. Okay. And so we see the tibia. Okay. And this is going to be on top or towards the anterior a little bit more. Okay. And then the fibula is lateral. And you can see that that makes up your lateral malleolus, which is that little ankle bump. That's not a separate bone. That ankle bump off to the side, okay, that's your lateral malleolus. The ankle bump on the inside, that's your medial malleolus. Okay. And that medial malleolus is the tibia. The lateral malleolus is the fibula. You'd see this interosseous membrane just like you saw with radius and ulna. So that is that nice connective tissue trying to stabilize these two bones together. Okay, so what we see here is the head of the fibula up here. Okay, and this is not an uncommon one to kind of pop out this way. So this is a common one that I adjust, that when there's stress on the body, you could see where you would jump down and there would be stress translated through these bones, and this pops out that way ever so, just ever so slightly. Okay. What else do we see here? We see the tibial tuberosity, or this little bump here on the tibia. This is going to be a site of what we call Osgood-Schlatter disease. OS, Osgood-Schlatter. Right. Osgood-Schlatter disease. You'll see this. The typical, there's atypicals as well, but the typical will be a male that had a very strong, very fast growth spurt, teenage boy with a growth spurt. And the bony process here sticks out a lot and is painful because it's an avulsion fracture. Avulsion. Let me spell that right for you. A-V-U-L. Avulsion fracture. Okay, so avulsion fracture. And so this is going to pull here because the tendons and the muscles are stronger than the bone as they're growing. And it's going to give little tiny fractures to this area, and it'll stick out more, it'll be painful more. And so they just tape it down or put a little Showpat's brace on there. Okay. They just tape it down or put a little Showpat brace on there. Not an uncommon thing to see in a teenage boy with a very quick growth spurt. Okay. Another viewpoint here of your tibia and fibula. So hang out with this picture and kind of test your knowledge of all these bony landmarks here. Tarsal bones. We're going to look at all of these bones right here. Tarsal bones. So we're going to see right here, okay, is this viewpoint right here. You could see the different arches here. Okay, the longitudinal arch going this way, the transverse arch going that way. Okay, so we're going to see tarsal bones and their names here: calcaneus, talus, navicular, cuboid, and then the cuneiforms of the lateral, intermediate, and medial, and then our metatarsals and our phalanges. Okay, and so what you'll see is this arch here: longitudinal, transverse arch, phalanges, metatarsals, cuneiform, navicular, talus, and calcaneus. Okay, and so that's this viewpoint right here, but just a little bit bigger. So our metatarsals and phalanges, this is just like our hand, right? So we see these 5 metatarsals, and now we have hallux is our big toe. Pollex was our thumb. Hallux is our big toe. Okay, so just like in our hand, we've got 14 phalanges. Our thumb and our big toe only have 2. Everybody else has 3. Okay, and then we see these arches here as well that we looked at. Good. let's go through these right here again. Okay, cool. All right, so we're gonna look at the phalanges, 2 here, 3, 3, 3, 3. And then we see our metatarsals here, okay? And then our tarsals here, okay? And then the calcaneus is the heel, okay? That big bump on your heel, that is your calcaneus. You could see it from this viewpoint, you could see it from this viewpoint, you could see it from this viewpoint, you could see it from here, okay? And then the next biggest one, so talus is the biggest. The next biggest one is going to be this, I'm sorry, calcaneus is the biggest. I repeat, calcaneus is the biggest. The next biggest is your talus bone. Okay? And this is like a talon for a bird, a talon, okay? For a bird, talon. And right there, it's going to give you that dorsiflexion and plantar flexion. So your ability to point your toe and lift your toes up, okay? That joint right there, okay? That action is thanks to our talus. Okay. Cuboid off to the side here. Navicular means boat, okay? And it's over here. And then we see our talus and our calcaneus. And then the little cuneiforms. Okay, you can see them over here too. Great. All right, so differences between male and female in the adult human skeleton. So remember when we were looking at things like when we see TV shows about forensics, or maybe you'll be working in forensics, and how they identify different bones. Okay, so if you ever watched Bones, the TV show, okay, so she did this all the time. She would look at these different bones and then speculate on whether someone was, or not speculate, really, just be able to tell whether someone was a female or a male. Okay. And so you'll see these differences in the bones. So male is going to be heavier, rougher surface, more sloping forehead, presence of supraorbital ridges. Sinuses are going to be larger. Cranium is about 10% larger. Mandible, the lower jaw, it's going to be bigger. Teeth are going to be bigger. Okay. Pelvis, narrow, robust, heavier, rougher surface. Pelvic inlet is heart-shaped. Okay. Pelvic inlet is heart-shaped. Iliac fossa is deeper. Ilium is more vertical, extends farther superiorly. Inferior angle less than 90 degrees. Acetabulum is directly lateral. Okay. Obturator foramen is more oval. Ischial spine points medially. Sacrum is long, narrow, triangular with pronounced curvature. Coccyx points anteriorly. Bone weight is heavier. And the bone markings are more prominent. Female is going to have a lighter, smoother surface, more vertical absence of supraorbital ridges of the forehead. Sinuses are going to be smaller. Their cranium's about 10% smaller. We're lighter, we're smaller mandibles, smaller teeth. Okay. General appearance of the pelvis, broader, lighter, smoother surface, oval to round pelvic inlet, shallower iliac fossa, less vertical ilium. Pelvic angle or pubic symphysis angle is 100 degrees or more. Okay. Acetabulum places slightly anterior and lateral. Obturator foramen is more triangular. Okay. Ischial spine points posteriorly. Sacrum is broad and a short triangle with less curvature. Coccyx points inferiorly. Bone weight is lighter and bony markings are less prominent. All ways to forensically describe male versus female attributes of the skeleton. All right, some age-related events in the skeleton. So you can take a look at these, right? So we're looking here at the region of the structure, the events, and the age right here. So let's take a look at this together. So region, oops. There we go. Let's try it again. Region or structure over here. So in general, we see the bony matrix events, reduction in mineral content begins as we get older. Okay, so at age 30 to 45, values are going to differ for males versus females between ages 45 and 65. Why? Because of hormones, right? And menopause. Okay. And then similar reductions occur in both after the age of 65. Markings, events, reduction in size, roughness, gradual reduction in increasing age and decreasing muscle strength and mass. The body is going to remodel according to its need. Okay, so Wolff's Law and Davis Law. Wolff's Law is bone is remodeling according to its need. Davis Law is muscle response according to its need. So the more you work out and the more you stress the system, the stronger it's going to be. Okay? And that can help us as we age. Skull, fontanelles. The closure of these fontanelles or these soft spots is completed by the age of 2. Frontal sutures, okay? Fusion is about age 2 to 8. Occipital bone, fusion is about ages between 1 and 6. Pretty broad area there, 1 to 6. That's a lot, right? Styloid process fuses with the temporal bone at about age 12 to 16. Hyoid bone, the hyoid bone in the neck, complete ossification and fusion happens at about 25 to 30 years old. Pretty amazing, right? Teeth, loss of baby teeth. Okay, appearance of permanent teeth, eruption of permanent molars, and this is going to be detailed at what age of different teeth. Okay, in chapter 25. Mandible, loss of teeth, reduction in bone mass, change in angle of the mandibular notch. So this happens as we age, okay, and accelerates in later years, like age 60. Vertebral column. So we're born with that kind of C shape. Okay. An appearance of the major curves starts at about 3 months or with tummy time. We're going to get that cervical lordotic and lumbar lordotic curves with tummy time. Okay. And this continues from 3 months all the way to 10 years. This shifts throughout life though. So I'm a chiropractor. I see the cervical curves and the thoracic lumbar curve shift throughout life due to functional aspects of someone's life. Okay? So what they're doing, again, everything remodels according to its need, whether we want it to or not. So if we sit all day, we're going to lose certain curves of our body. Okay, so that cervical curve will start to straighten out and even reverse sometimes. Okay. Intervertebral discs, reduction in height, percentage contribution to weight, accelerates later in life. So they dry out. They dry out and they squish down. Okay. So gravity over time is going to squish them down and they're going to dry out because of age. Okay, so they will reduce in size and get smaller. They rehydrate a little bit and plump up at night though. So if you ever notice that you feel a little taller and a little thinner in the morning, right? Because we're just a little bit taller, we're stretched, and then they compress and we feel a little stumpier as the evening goes on, right? It's because those vertebral discs dehydrate. Long bones, epiphyseal cartilage. So we see fusion ranges vary according to specific bone under discussion, but general analysis permits determination of the approximation of age. And so that's what we're talking with the forensics of things. Pectoral and pelvic girdles, epiphyseal cartilage fusion, overlapping ranges are somewhat narrower for long bones, including age 14 to 16, 16 to 18, and 22 to 25. Again, why on that TV show Bones, she could identify how old someone was just by looking at a bone. So all these different bony landmarks according to what specialty you want to go into. Excellent. Thank you for your time. I will see you for the next chapter.